Adar Poonawalla, who heads the Serum Institute of India, which is, remember, at the forefront of vaccine development as far as the COVID-19 vaccine is concerned, has put out a very interesting tweet. He says in his tweet, and I'm quoting him, "Quick question. Will the government of India have 80,000 crores available over the next 1 year? Because that is what the Ministry of Health and Family Welfare is going to need to buy and distribute the vaccine to everyone in India. This is the concerning challenge we need to tackle." And he has tagged PMO India, which is the official Twitter handle of the Prime Minister's office. My colleague Sukirti, tracking the details of this story, is now joining us. Sukirti, it's a very interesting tweet that has been put out by Adar Poonawalla.
Well, yes, interesting and odd for him to tweet this out, considering the Serum Institute of India has already been in touch with government officials at various levels, because when they were given the permission to carry out the trials of the AstraZeneca vaccine in India, they are already in the process of working out the entire logistics of, if this vaccine works out, how will the distribution take place, and all of those nuances will be figured out. So considering that they are already in talks with the government, and they are the ones under whose authority they're supposed to work, very odd that they would question the health ministry or tag the PMO's handle and ask them whether there are enough funds or not. As far as the government side is concerned, the health ministry has constantly been saying that they have a specific group called the National Expert Group on Vaccine Administration. It's a specific committee headed by NITI Aayog member Dr. V.K. Paul that is looking into the entire logistics of how the vaccine distribution will work out. And so far, the government's entire highlight of whenever they've been questioned on the entire issue of when we have a vaccine, how the rest of it is going to work out, they have never cited the lack of funds as an issue. More of it has only been along the lines of how will the distribution and delivery part of it will work, especially in a country like India, where it will also be need to reach out to these remote locations, rural areas, villages. How will that work out? So at least from the government side, they have never cited a lack of funds as being an issue, but logistics being more focused on how the distribution and delivery will be focused, and the center earlier asking state governments that please do not start making plans on how you will focus on vaccine administration in your state, because this entire system is going to be centralized. So that's been the government's version, but odd at this point of time for the Serum Institute owner to question the government on whether enough funds would be available.
Well, it's very interesting because remember the Pune-based Serum Institute, Sukirti, and you've been tracking the details of this story very closely, is the world's largest vaccine maker. In terms of the number of doses of vaccine that it produces. It is currently working on several vaccines, including, of course, mass production of the Oxford AstraZeneca vaccine, which is really where the world has its hopes pinned. And it is, it's curious in a certain sense to see the man at the helm of, vaccine development as far as the world is concerned, to question the government very publicly on Twitter, asking whether the government has 80,000 crore rupees for, the disbursement, or rather, to ensure that the vaccine reaches everyone. So it is in a certain sense, very curious that this tweet has been put out in the public domain.
Well, yes, absolutely, Rishka. This is one vaccine on which, like you mentioned, everybody has had their hopes pinned on, because the phase 1 and phase 2 trials that were conducted in UK, apart from one glitch that was noticed recently, and then trials had to be paused for a short period of time, and then they resumed again. But if you keep that aside, all the results that had come out of the phase 1 and phase 2 trials had been very encouraging in terms of how the immune system of the volunteers of the human trials was responding really well to this vaccine. Yes. And that is why everybody has had their hopes pinned on it. And even when the Serum Institute declared that the phase 3 human trials would be done in India, that had led to a lot of hope. So considering it is a vaccine on which has been the highlight, which has been the one that everybody is hoping is going to save us from this pandemic, so it has already been the focus. But like I said, the Serum Institute already has certain contracts with the government, and they are being regulated by the DCGI, or the Director General of Food, regulates all of this vaccine trials in India. They are already in touch with the government. So for them to go in the public like this on a platform like Twitter and question
it's definitely
whether the
a very
government would have enough funds or not,
it's definitely a very curious tweet. It's definitely a very curious tweet, one that definitely, does warrant questions to be asked of both the government as well as the Serum Institute of India on whether they believe that the government doesn't have the funds, which is why this question has been put out in the public domain, or what really is the story here. We'll continue to track the details of the story very closely. Appreciate you, Sukirti, for joining us with the details.